Today's talk is on cancer. Did you know cancer is a leading cause of death worldwide, responsible for 1 in 6 deaths? For many, just hearing the word cancer can feel like a death sentence. But here's the thing, cancer isn't just one disease. It's a collection of diseases that can develop and evolve in many different ways. Some cancers grow slowly and unpredictably, while others can be aggressive and spread rapidly. Some can even remain dormant for years. Despite these differences, most cancers share some key characteristics. The affected cells can lose their normal function, ignore growth boundaries, invade nearby tissues and organs. They can spread to distant parts of the body, compromising vital processes, which could eventually lead to death. However, there's hope. Ongoing research and technological advancements are continually improving cancer prevention, early detection, and treatment. In the meantime, understanding the concept of cancers goes a long way in reducing its incidence and minimizing its impact. In this video, my aim is to help you understand the basic concepts, enabling you to make informed decisions related to cancer prevention and diagnosis. Hi, I'm Dr. Francisca Osage. Thank you for joining me and Francisca on Health Matters. Now, what is cancer? Cancer is an abnormal state whereby certain cells lose their normal sequence of development, otherwise called cell cycle, leading to alterations in the normal cell growth, maturation, and death processes. It could also involve defects in cell repair function. Now, such cells grow uncontrollably, lose their normal function, invade nearby tissues, and even spread to distant organs. Now, such disruption compromises cellular, organ, and even systemic functions. Cancer isn't a single disease entity identified through a particular investigative method or prevented and treated in a particular manner. It comprises complex disease processes emerging from these cellular disruptions and having diverse manifestations depending on the source of the cancer cells. While adopting healthy lifestyle can significantly reduce the incidences of cancers, it's not a foolproof way to prevent cancers. The changes that transform normal cells into cancer cells stem from alterations of genetic materials called deoxyribonucleic acid, DNA. These alterations are called mutations. Our bodies are made up of trillions of cells, and at the core of each cell are complex molecules called DNA. Each DNA molecule contains a code, and sets of DNA align together to encode specific instructions or information essential for normal cell development and function. There are coded instructions that signal for cell growth and division, a phase for cell rest, and finally, a programmed cell death. But sometimes, certain factors or conditions, either internal or external to the cell or body, can cause alterations to one or more DNA codes. At times, the original encoding is spared, but sometimes the disruptions can modify encoded information or instruction, leading to outcomes of either altered instruction, no instruction at all, or instruction no longer making sense. This is called a mutation. When this happens, it can throw off the body's balance, potentially leading to cells growing out of control. That's how cancers can begin. What causes these mutations? Now, over time, some happen spontaneously, while some others are triggered by certain agents. We call these known agents carcinogens. They are substances or exposures that increase our risk of developing cancers, and there are hundreds of carcinogens. I will identify some common carcinogens and put them in certain categories. Let's start with the chemical carcinogens, and the common source is tobacco smoking. It's a major culprit here. Numerous toxins inhaled during tobacco smoking are linked to cancers of the lungs, mouth, throat, stomach, bladder, and even the cervix. We have asbestos, often found in old buildings. It's closely tied to mesothelioma and lung cancer. There is benzene, found in some industrial solvents, associated with leukemias, a kind of cancer affecting the white blood cell. We have physical carcinogens, associated with ultraviolet radiation and ionizing radiation. Ultraviolet exposure from the sun and tanning beds is a major risk for skin cancer. There are the biological carcinogens. You have HPV, human papillomavirus, popularly linked to cervical and anal cancers. There are the hepatitis B and C viruses, which raise the risk of liver cancer. There's the Helicobacter pylori, commonly called H. pylori, associated with stomach cancer. Now, apart from these carcinogens, we might be subject to certain risks that can predispose cancers. Common risks include age. The risk to certain cancers increases just by our getting more advanced in age. There's family history. Inherited genes like the BRCA1 and BRCA2 can increase the risks of breast and ovarian cancers. There's the environmental exposure. Living around pollution or even being around secondhand smoke can predispose to cancer. And there's personal habits. Smoking, heavy alcohol use, frequent sunburns, or unsafe sex practices. All of these can contribute to cancer risks. Some of these risks we can control. We can quit tobacco smoking. We can protect our skin from the ultraviolet rays from the sun. Others we can't. We can't control our getting older. We can't control the genes we inherit from our parents. And that is exactly why screening is important, even when we adopt the healthiest of lifestyle. There is science behind why people within defined age groups are encouraged to get screened, especially because some demographics of certain age groups are more at risk to specific cancers. Screening is crucial because it helps catch cancer early when it is most treatable. Screening can help identify abnormal cells or tissues before they become invasive, allowing for early intervention that can minimize both health risks and costs. And screening is not a one-time thing. Screening can be recommended every year, every 3 years, or even every 10 years. And just because your first screening is negative doesn't mean you should skip future screenings. And if you have a positive family history or an abnormal finding in which the follow-up tests yield negative for cancer, the screening that follow would be more frequent than recommended for the general population. Now, when a suspicious growth is discovered, the follow-up test will require identifying its nature, whether it's a benign growth or a malignant growth. And this leads us to the next concept. Cancer is generally described as a tumor, but cancers are not the only kind of tumor. So let's understand what a tumor is. A tumor is a mass of cells or tissues that forms when normal cellular growth is disrupted, leading to uncontrollable cell growth. There are two main types of tumors. You have the benign tumor and the malignant tumor. Benign tumors arise from cells experiencing growth disruption, but remain confined to their immediate surroundings. They do not invade distant tissues, a process called metastasis, and their cells retain recognizable features when viewed under a microscope. Now, benign tumors are not cancers, although when viewed grossly, they might resemble cancers. However, they grow slowly, and the cells retain typical features and even functions. Malignant tumors, on the other hand, are cancers. These tumor cells grow rapidly and are invasive, spreading to neighboring and distant tissues. When examined under a high-powered microscope, malignant cells are seen to have lost the features of their typical cells. And also from a physiological perspective, they have lost their typical cell function. Now let's talk about diagnosis. Cancer can be diagnosed during a routine screening when there are minimal or no symptoms present. Alternatively, a cancer diagnosis is made during investigating the causes of symptoms expressed by an individual. The pathway for diagnosis of a cancer varies depending on the type and nature of the cancer. Once cancer is diagnosed, usually after a pathologist has thoroughly examined the cells and tissues, it is crucial to determine the extent of cellular transformation, also called the grading of the cells, and the extent of the spread of the cancer. This is called the staging of the cancer. And these are put into considerations when decisions regarding the kind of intervention is taken and helps decide the appropriate course of action. Common interventions include surgery, mostly for early stages. There's radiotherapy, chemotherapy, hormonal treatments, biological therapies. There's also bone marrow transplant. And sometimes a combination of some of these therapies are applied. The type of intervention depends on the nature of the cancer and its stage of development. Now finally, there's the concept of palliative care when it comes to the management of cancers. At this stage, the focus is on relief in pain and other forms of suffering to provide some relative comfort. Unfortunately, curing cancer is no longer an option. These interventions can be provided at a healthcare facility, a community center, or even through home-based care. Prevention is always the best route. When it comes to cancer prevention, making healthy choices is crucial. However, because of the ambiguous nature of cancer, being aware of the risks and understanding the nature of cancer can go a long way in curbing its incidence. When you know what to watch out for, you can take real steps to protect your health, whether it's reducing exposure, treating infections early, or just making better lifestyle choices. We all have the power to act, and I believe having this fundamental knowledge of cancer can go a long way in helping you make better decisions regarding your health and that of your loved ones. Thanks for watching. Again, I hope you found this informative and educative, and if you have, please subscribe, and I'll see you in the next one.